In order to see that, we have to put fluid into the uterus and push those walls away from one another. So it's generally done in one of two ways, with a study called an SIS, or saline infusion sonohystogram, or a study called an HSG, which is a hysterosalpingogram. One is an ultrasound-based water test, one is an X-ray-based test.
And excuse me for being ignorant, but do you just like push water in and then it expands and then they pee it out?
Great question. Great question. So the way I like to explain it, because people usually are familiar with a pap smear screen. So the study always starts sort of like a pap smear. We would place a speculum in the vagina, we clean the cervix with an antiseptic solution, and then we use a little catheter. It's about the size of a tip of a pen. Place that just inside the uterus, and then we fill up the uterus either with water in the case of an SIS or with dye that you can see on X-ray in the case of an HSG.
And then what happens?
And then we take pictures. Okay. So we either take ultrasound-based pictures, or in the case of an HSG, we take X-ray pictures. That part is crampy.